And now, Wellness Wednesday, sponsored by Dr. K.
Ever have everybody come and have crickets stuck in their teeth?
Oh, goodness. Yeah, but I will look forward next time. Well, we have Dr. K with Dental Care in Baltimore back here for our Wellness Wednesday.
And today we're talking about the stress and how it shows up in your mouth. And I'm sure there are some ways that we all probably are experiencing. We just don't even realize it.
Yes, so stress impacts more than just your mind and your body. It actually does show up in your mouth. A lot of times patients will come to me with dental problems that tie directly to their amount of stress. One of the biggest things that I see is teeth grinding and clenching. Another name for that is bruxism. So there's nighttime bruxism and daytime bruxism. Nighttime bruxism is actually less common. It impacts about 1 in every 10 people. And that's a sleep disturbance disorder. Daytime clenching is more directly tied to stress, and that impacts about 1 in 3 adults, so it's pretty common.
Wow, yeah.
Yes, and it can lead to a lot of wear and tear on the teeth over time.
Yeah, and we're talking about how common it is. I experienced it during that. You mentioned you do it during the daytime.
Yes.
I mean, what are the signs that you can look out for? Because I know the most common is soreness, but I have had, like you mentioned, cavities, teeth being chipped. What are some of those signs to look out for?
Sure. So when patients come in, again, a lot of patients are unaware that they're doing it. So what we see are signs of generalized teeth wear, so flattened teeth or chipped teeth, like you mentioned, chipped fillings, chipped crowns, even fractured teeth. Sometimes patients will come in, and I've seen this, just teeth have completely fractured because of clenching or grinding. Another sign that we see are tori, which are large bones underneath of the tongue, and that's just the way the body responds to a lot of chronic forces. It just lays down extra bone. Or ridges along the tongue, we call it scallop tongue. Those are also signs of clenching and grinding. Patients, as you mentioned, will say, I have soreness in my, we call it muscles of mastication, masseter. They're tired, they're fatigued. Neck pain, even migraines can be associated with clenching and grinding.
Okay, so the fix. I mean, if you notice you're having all these problems, of course we call you, but what do you do?
Yes, so if you are a nighttime clencher or grinder, your dentist will probably prescribe a night guard, and that's a custom night guard that fits over your teeth. It doesn't prevent or stop the behavior, but it just protects your teeth while you're grinding at night. During the daytime, if you're a daytime clencher or grinding, actually Botox has been found to be very helpful when injected into the masseter muscle. It will relax that muscle that is responsible for clenching and grinding. But one of the easiest things that I tell all of my patients, if you're a daytime clencher, just being mindful, your teeth shouldn't be touching unless you're chewing, excuse me, which a lot of people don't even know. So I say, yes, teeth apart, lips together, deep breath through your nose. So if you're just sitting there and you're stressed at work, you're stressed in heavy traffic, and you notice your teeth are together, you're stressed and you're clenching.
Teeth apart, lips together, breathe through your nose.
Yes. I'm not stressed. I guess maybe I am underlying. I don't know what's happening. I just felt that. All right. Thank you, Dr. K. Where can people find you if they want to find help and advice?
Yes, so we are located in Owings Mills at the LifeBridge Building and Foundry Row Shopping Center. You can go to my website, drkirotolson.com.
Dr. K, thank you so much. Always great suggestions, great information.
Good.
Wellness Wednesday on WJZ at 9 is sponsored by Dr. K.